Today, we're going to be talking about natural products for joint health. And this is a really exciting topic for myself and Dr. Rosalie. It's actually one that we haven't done before. So I'm Dr. Molly Force here at Prosper Natural Health. I'm the clinical director, and I'm joined by Dr. Rosalie de Lombaert. And we're going to be covering joint health today. And as naturopathic physicians, we have a little bit of a different approach than conventional Western medicine. And one of our goals for today was going to be to make sure that we could really talk about more than just the joint when it comes to osteoarthritic pain, and also when it comes to autoimmunity. So we're doing these talks here every month that really focus on different topics which are coming up with our patients. So we invite you to join in on those and check out our previous recordings. We have quite a few at this point. So they're on our website at prospernaturalhealth.com underneath the education tab. So in regards to joint health, this is something that's actually really near and dear to my heart. And it was one of my reasons for actually pursuing naturopathic medicine as a clinical degree. So when I was about 20, 21, I started having really bad osteoarthritic pain in my hands. And I remember I had this elderly great aunt who was almost 100, and she bought me a steering wheel cover because I was having so much pain just driving even and in my joints. And when I was kind of researching different medical school options, as naturopathy came up as a way to look at how we approach health and medicine, it was really an exciting opportunity for me to kind of think about how can I find more health balance for myself. And it's been a pretty transformative journey personally, learning about ways that I can support my joint health and living essentially pain-free, as long as I'm addressing those issues for my body. So in regards to joint health, today we want to talk about exactly what's happening in the joints, because you'll find one of the pieces for us as more functional doctors is we really want our patients and our community to understand the physiology that might be breaking down for them when they're dealing with different diseases or pathologies. And we want to talk about what's required for healthy joints. And then, of course, today we're going to be really spotlighting updates in the primary literature, the medical literature for different natural ways to support joint health, and some of our clinic's favorite options that we use a lot of times with our patients. So let's talk about the stats here for joint pain. It's kind of shocking that so many of us deal with joint pain on a day-to-day basis. It's about 1 in 5 adults in the US who have been diagnosed with a form of arthritis. It's more common among women, and it's more common among veterans as well. We also see that there's a prevalence, of course, that happens with age. You know, this idea of wear and tear on the joints is a factor that plays in here. And we do see that more than half the population, once they reach 65, is having a diagnosis of some form of arthritis. So when we're thinking about healthy joints, because we always want to start from what is the body trying to do? What is the purpose here of these joints? We have 3 main types of connective tissues, and we want to make sure you guys understand this, because when we're talking about ways to make the joints healthier and support the joints, we want to be thinking about some of these building components that are necessary. So we have fibrous joints, we have cartilaginous joints, and synovial joints. And we're going to really spotlight the synovial joints today because those are the ones that are helping us with moving to bones, like we think about the elbow joint, for example. But we have these other joints in our body which can also become arthritic and have pain. So we have these fibrous ones, which are temporary or like more immobile. We think of it that way. And then we have these slightly movable ones, which are cartilaginous. We think about those like the ones that are in the pelvis, for example. And then we have all these functional different joint types, which we have labeled. And each of these are going to have their own ways that they can break down because of their structural nature and different specific building tissue products that we need to really maintain. So let's talk about the synovial joints because those articulating joints that move tend to be ones that break down the quickest for people or have the most inflammatory response for people causing pain. So, of course, the job of these synovial joints is to really prevent this friction between the moving bones. So, for these bones to be able to move smoothly, we have this cavity, which you can see here in our picture. I don't know if you guys can see my cursor here, but we have this cavity which is filled with this synovial fluid, and lining that we have this fibrous connective tissue that helps attach to the bone. And we even might have a bursa on some of these, and that's like a little pad that can help protect that joint from any kind of impact. And then we also have on the surface of the bone joint, we have this hyaline cartilage here on this articular cartilage. And then there's also this fibrocartilage between the bones as well. So it's important to be thinking about all of these because it's going to affect what we're choosing as far as supporting building block wise for maintaining healthy joints.
So when we talk about the joints, there's a couple of things that can happen to the body. Of course, there's osteoarthritis, like Dr. Molly was mentioning, but there's also an inflammatory type of joint disease known as rheumatoid arthritis, or an autoimmune variety. A whole bunch of autoimmune disease can manifest as autoimmune joint pain. So these are similar, but also quite different. Usually with rheumatoid arthritis, we see multiple joints affected, or I'll say just in general autoimmune joint pain, where there's just swelling, heat, redness, difficulty with mobility, sort of a stiffness to the joints, and a wandering pain as well. I would say most often I see an autoimmune joint pain showing up in the fingers first, or in the shoulders, the one that's moving the most, for example. Osteoarthritis is more like a loss of space in between the two big bones. For example, here we're just seeing like the knee bone, for example, and the bones end up rubbing together without this nice synovial fluid in between them, which also leads to inflammation. And we don't typically see this as a wandering pain, and we often see it as an asymmetrical pain in the joints. And the stiffness is usually lasting less than 30 minutes in the morning. So in this doc talk, of course, we're talking about all sorts of joint pain, not just autoimmune varieties, but also the osteoarthritic varieties. Here we've circled the autoimmune varieties, juvenile arthritis being a type of rheumatoid arthritis that we see in children, psoriatic arthritis being the one in patients who also have psoriasis, this really itchy condition of the skin. Reactive arthritis being a secondary response to trauma to the joint or an infection in the joint. I've seen this with my patients who've had a knee replacement, for example, and then an infection, and then secondarily a reactive arthritis. And then rheumatoid arthritis, again, we just talked about that earlier. Fibromyalgia is a bit of a gray area in that it's not necessarily not necessarily autoimmune, and it's not necessarily like osteoarthritis, but there's this big pain component in the joints, but also the muscles. So we put a dotted line around this one because we have to think of it from both perspectives. The ones that didn't get circled here are more sort of osteoarthritic looking conditions. One of them, known as ankylosing spondylitis, has more genetic cause, where the lumbar spine ends up having this kind of osteoarthritic component to it. Gout, you've heard of in your big toe, even though it's red hot, it's not red hot because of autoimmunity. It's red hot because of uric acid buildup. And then lastly, that osteoarthritis we talked about as well. So this is a really interesting slide that kind of opens up the rest of the doc talk for us. So the science behind osteoarthritis is changing. And I learned a lot in researching for this doc talk because, and it's specifically from this primary literature, which we'll go into heavily. In that osteoarthritis, of course, we think of it as being due to wear and tear, and it's just wear on those joints and common symptom of aging, cumulative effects of mechanical wear. And that was sort of the running hypothesis for a long time. What we start to discover as time goes on and we do some further research is that there's actually a central nervous system component to osteoarthritis. That means that the brain is actually affecting what's going on in the joint. It's not just a knee issue or an elbow issue. There's also a brain issue going on. So long-term systemic inflammation, meaning whole body inflammation, can contribute to osteoarthritis, can contribute to a neuroinflammation in the brain as well. This causes an immune reaction, a microbiome shift. There's also, like we mentioned earlier, central nervous system mediated changes, circadian rhythms, difficulties with sleep-wake cycles, whether it's from shift work or in general. All of these things are components to this CNS theory. So, gosh, we've got to think about this by focusing beyond the joints. Our orthopedic specialty has to also consider the brain and the central nervous system, the nervous tissue. So, what's so interesting about this article that came out just a few years ago, December of 2019, is that they mentioned that, sure, okay, we've got all this information about osteoarthritis, but gosh, here's what we're really noticing is that that osteoarthritis happens before the diagnosis is made, and it happens actually in the central nervous system changes, this neuroinflammatory perspective. So this article talks through the triggers ultimately, which I mentioned in the prior slide, or this slide as well helps us think through it. The triggers that happen before the actual diagnosis is made. So of course we've got age and trauma to the joint, but also part of this central nervous dysfunction are things like obesity, excess adipose cells, genetic component, gender, and we see that being true with female sex having a bigger preponderance. The gut microbiome shift, and gosh, it just always comes back to the gut microbiome. If your GI tract is not healthy, it's really hard for the body to not be systemically inflamed. With my osteoarthritis patients, I see a huge shift when we go to an anti-inflammatory diet. And this also is affecting that gut microbiome. Diet, another piece there, metabolism, and that's also a genetic piece. But how well are you working through what your body is giving you? Are you absorbing actually all of the macros? Circadian rhythm, a big unspoken piece when it comes to osteoarthritis. How well are you sleeping actually affects how well your joints are doing. And then other comorbid factors is just, the list goes on of things that can systemically inflame you. All this said, these are factors that predate the osteoarthritis diagnosis and, which would ultimately in the allopathic world lead you to an elective surgery. Okay, we're going to do some surgical changes to this joint. Here's another kind of take-home image to think about. In the center is just this chronic low-grade inflammation, which includes neural inflammation, altered cell-mediated immune responses, which means, okay, we're maybe not necessarily in the autoimmune realm yet, but there's some immune responses that are causing a whole bunch of inflammation, and the joints are the ones that are registering that. Up top, we see again the central nervous piece of the HPA axis being involved in osteoarthritis. So HPA being hypothalamic pituitary adrenal axis, which are just the way the body talks to the central nervous system through hormones, and that access to the rest of the body is part of the picture when it comes to osteoarthritis. So gosh, in the smaller print here is just a way to discuss there's systemic inflammation affecting the brain, which is actually affecting the body's recognition of pain in the joints. Gut-brain axis on the right-hand side there is, again, what's your microbiome doing? Is your microbiome sending a whole bunch of inflammatory information to the brain, to the joints, and that the body as it is registering that in the way that it does. The joint CNS axis, which is a novel reality for me, is just there is a communication between joints and the central nervous system that is specific. And we see it being really important in osteoarthritis and the prognosis and the worsening and the progression of it. Lastly, the adipose brain axis is also a piece. So we see adipose cells actually putting off a lot of inflammatory cytokines that the brain registers, the joint registers, and all of that leads to osteoarthritis and chronic progression, thus downstream cartilage degradation, pain, disability. It's just, this is just a lot of stuff. But ultimately, the take home here is that there's more to osteoarthritis than just the joint.
So this is what we see clinically, which is so fascinating. We had been under this understanding for years that especially osteoarthritis was just this aging and wear and tear of the joint. But what we see clinically, which is so interesting, is there may be a person who has, bone on bone for their joint space and having on imaging, but having no pain, versus somebody who has way more cartilage left and they're in much more pain. Okay, so as clinicians, it's like this little red flag. There's something more involved here, and this is speaking to that. It's this paradigm shift of let's not just focus on the joint. Let's remember that the body is connected and signaling these very important pathways, which will affect inflammation and the longevity of a joint. So what do we do about it? Here at Prosper, one of the things that we like to see sometimes are labs, because they can really help us understand what is triggering an inflammatory response, or which of those pathways are really implicated in being imbalanced and really causing some of the degradation to this, the joints that are involved. So oftentimes we'll ask our patients to run food sensitivity panels. This is a way of assessing the immune system and looking at that gut-brain axis. Specifically, we're often looking at IgG here, which is an inflammatory marker for our immune system, showing that our body has tagged these certain proteins. What's frustrating about IgG for a lot of patients is it might have been that they've eaten a food and then they don't react for another up to 72 hours. So it's really hard for them to pinpoint from a diary standpoint, like, oh, I had the egg and then it inflamed me and caused more joint pain 3 days later. So it's very nice to have blood work to figure out what the body has tagged and is going to cause an inflammatory cascade around. So that's one piece that we're often asking. When we're thinking about foods, we know this is a talk really more on natural products to support joints, but we had to mention, this is really fascinating. We have this autoimmune component that we see clinically with patients where certain foods will really seem to trigger immune reactivity, really seem to trigger inflammation. And we do have evidence in the medical literature that certain components, for example, in this article that was done in 2020, is about nightshades ingested by people who have rheumatoid. Now, remember, that's the autoimmune form of arthritis where the immune system is very tipped. But in this article, they're saying like, hey, it does seem like there is more joint inflammation and pain and degeneration for people who are including those nightshades in their diet. And at the same time, we have the American society that deals with joints, the Arthritic Foundation, who is saying like diet doesn't matter. Diet doesn't influence joint health. But we see in the medical literature, there's this growing evidence that it absolutely does. And as physicians, who are managing diet and lifestyle modifications, it is very implicated. So we see it make a huge difference for our patients. And what, ultimately we think about the nightshade piece for this autoimmune component is it really ends up boiling down to the lectins, which are found in these foods. And we want to try to remove those as much as possible. Dr. Rosalie and I, as we were presenting this, were saying that it was almost 100% of our rheumatoid arthritis patients who benefit from removing nightshades from their diet. So just really interesting. You hear these different ideas from the different factions of medical associations and things like that. But it's always nice to dip in and see what science is actively showing us as far as this medical literature stuff. So couldn't help ourselves, had to talk about food. Here's another piece as far as food, as far as labs and clinical evidence that we like to have for some of our patients. If we're worried once again about that gut brain axis, then we want to often see what's going on with the microbiome. And here's one of our tools for that. We use PCR, which is that DNA amplification style of testing to figure out who our patients' guts are colonized by. So which microbes might be overgrowing or undergrowing, underperforming, to help them with their immune balance and their intestinal health. So this is one of our options that we have. Another lab that we'll do to help us differentiate for types of, if we're concerned about the autoimmune type of arthritis or joint pain or changes, then we're often running something like this specialty marker panel. And this is just a really fantastic piece for us because each of these antibodies, which are tested, can be very, very expensive through conventional testing. So it's nice to have a specialty lab that's quite accurate, which will look at this whole picture of different antibodies. So it's just another piece that we use to look at markers for immune activation, which can help us understand a diagnosis if we're concerned about autoimmunity. Remember, with both autoimmune arthritis and our classic osteoarthritis, in both cases, the immune system has an imbalance. But with the autoimmune cases, it's the immune system that's attacking self-tissues and causing that pretty rapid, oftentimes, degeneration of those things like the joint spaces. So you guys are here to talk about, we're here to talk about these natural products today. So we want to remind you, of course, we've got good availability of these through our in-person store. And then we also have an online store so patients can access these. And these are physician grade products that are vetted by us. So we just wanted to make sure you guys know that you have an opportunity to access those if you need them. We want to talk about probiotics first because the gut health is so important. Many of you have heard us talk about probiotics before and their importance. I'm going to pass this over to Dr. Rosalie for this part.
So, gosh, probiotics, such a hot topic. And what we've seen as in the advent of these encapsulated probiotics is just data that's all over the place. We've seen an uptick in, in like a monoculture of the microbiome of the gut bacteria. We've seen it. We've seen other data that has to do with diminishing pain or helping with depression. Or, gosh, it's just there's so much to probiotics. At the end of the day, it's very much an individualized decision. So it has to do with the individual microbiome. So if someone has some underlying SIBO, for example, which is small intestinal bacterial overgrowth, too much of one type of microbiome or one type of microbe in the microbiome, then of course we've got to use a probiotic that's going to support the variety of other microbes in that gut. So, I'll reach for those patients. I'll reach for one called C Biotica, which has a blend of microbes that don't flare the SIBO, this kind of inflammatory intestinal overgrowth condition. Then, if it's just a regular maintenance dose probiotic, because we're trying it to see if it's going to help with OA, with osteoarthritis, then I would say a variety of different microbiome supportive probiotics that have lactobacilli, bifidobacterium. That's looking more at our HLC intensive capsule line. We also have probiotics that are specific for children, since they need a lot more bacillus varieties, or maternity, or folks that are breastfeeding. It's just the microbiome shifts in different times of life. What's also clear is that we do need some prebiotics on board. Prebiotics are food for the probiotics, and we want to make sure that those are feeding the good probiotics. So that's where I start to reach for things like my Probiotic Supreme product or my Strengthia, because those contain prebiotics in them that are going to help be food for that probiotic dose that we're giving you and support the microflora and their diversity. Probiotics end up being pretty well researched here when it comes to osteoarthritis. As I mentioned earlier, the what's known as the pathogenesis, or what causes osteoarthritis, is multiple pathways. One of the proposed pathways here is that there is a gut-brain axis dysfunction because of low microbial diversity, leading to more immune intestinal inflammation. So again, this gut-brain axis piece can be corrected with the use of correct probiotics.
So we want to talk about a variety of different anti-inflammatories today. Some of these are going to do very specific things for different areas of the body. And when we're thinking about joints, that's important to consider. But when we're talking about these today, we're going to go over things like, we just talked about our probiotics, but we're going to talk about collagen and some of the building blocks. We're going to talk about herbal anti-inflammatories, which include things like quercetin and skullcap and devil's claw. We're going to talk about bromelain, which is an extract from pineapple, which is a proteolytic enzyme. And then we're going to talk about some topicals and get into some of the CBDs and things like that. So let's start by talking about collagen. Collagen's a building block agent, and there are different components within a standard collagen peptide. So if you're buying a standard collagen peptide, like over the counter, you're getting a mix. You're getting a mix of things that are helpful for skin. You're getting a mix for things that are helpful for joints. You're getting a mix of things that are helpful potentially for bone as well. So there are different amino acid building blocks within that. Some of our collagen supplements are more specific. So this is, for example, this whole body one guarantees that it has the building blocks for not just our hair and skin, but also our bone. And then it has collagen products for our cartilage and our joint spaces as well. So these are really helpful when we're wanting to make sure that people are getting the nutrients that they need to maintain that fibrous and cartilaginous network around their joint spaces. Or if they know that there's been significant degeneration from age or long-standing inflammation, it's important to be having these building blocks so the body can do some of that repair. We also sometimes will be combining a collagen with an anti-inflammatory. So this product, Arthroben, is one that we'll reach towards frequently for that kind of thing. It contains this this form of collagen peptides, which guarantee to have the building blocks for tendons, as well as that fibrous network, that Fortigel and the Tenda Forte, are kind of trademarked, patented chunks of collagen peptides that are guaranteed to be in that form of collagen. And you can see there's 10 grams of that per scoop. And then also this patented proprietary blend called Univestin, and it has quite a bit of research behind it, which is a combination of 2 active ingredients from herbs. So we've got Scutellaria, which is a Chinese skullcap, and crutch tree that they are combining and patenting into this blend. And both of these are strongly anti-inflammatory. And there's research here that I'm going to share about with you for collagen. Actually, I'm going to have Dr. Rosalie step in and do that. We're going to take turns. And then we're going to talk about the Univestin in a second.
Thanks, Dr. Molly. So there's 28 different types of collagen. So what's really interesting about this article here is that it talks about type 2 collagen, type 2 being specific for the joints and specifically used in osteoarthritis. And so, gosh, this was a really interesting study that had 40 milligrams of type 2 collagen, some glucosamine chondroitin on board, or placebo for 180 days. And they did see a statistical significance that, yeah, this works against placebo, that the pain levels decreased in this randomized control trial. And then here is the data behind the Chinese skullcap and the Kutch tree. And these are, again, these have been used in folk medicine for years, centuries. And it's just a matter of our traditional medical algorithm that finally studies it. And so what I liked about this study was that it was a 1-week study where it looked at the combination of these two as compared to naproxen, which is a non-steroidal anti-inflammatory drug. And, you know, either 500 milligrams of this combination or 440 a day of the naproxen, again, in a double-blind randomized controlled trial. They noticed that, yes, gosh, pain in knee, range of motion, overall physical activity were improved statistically over just this 1 week, as compared to this other kind of very well-known allopathic standard of care NSAID perspective. So gosh, it's just really beautiful when we see this old folk herbal medicine shine brightly amidst the other stuff. So we'll talk about curcumin as well, since this is when we think of anti-inflammatory herbs, we think of turmeric. And again, not all curcumin products are made the same. And I often see this underdosed in my patient population. We think for acute sort of inflammation modulation, we want at least 3,000 milligrams. And that's what I see really start to cut back on big inflammatory issues, whether it's osteoarthritis, rheumatoid arthritis, or something else that's raising the inflammatory markers. So some of these physician grade products have there are little shifts amongst all of them. What's been big recently, or in the last maybe 10 years, is adding black pepper to curcumin, which is something that I like to stay away from, actually, because black pepper not only is in a nightshade, but it inflames the gut so that the curcumin is better absorbed through intestinal permeability. So sure, it comes back in the data as well. We absorb way more curcumin, But what I don't like is that we've contributed to intestinal permeability. So some of the products we carry have that piece removed, but have other pieces added. So they make them more bioavailable by making them into a phytosome or adding a micellized fat to it, so it's most bioavailable, or just in pure liquid form. So, the curcumin veil, I think, is in MCT oil or coconut oil, as compared to the curcumin phytosome is in sunflower lecithin. So again, it very much depends on the patient what I reach for in terms of the turmeric products. And here's some research. Again, big part of our doc talk here is diving into the primary literature, so you guys know where we're getting these recommendations from. And so curcuma domestica also is a new way of describing curcuma longa turmeric. Has been compared head on head with ibuprofen in patients with knee osteoarthritis. And gosh, we see it as effective. So with the fewer side effects that the NSAIDs carry. So, ibuprofen dose for this study was 1,200 milligrams a day versus curcumin at 1,500 milligrams a day for just 4 weeks.
So turmeric, curcumin is definitely one of our favorites, kind of tried, tested, and true. There are some patients that tend to have a little bit of irritation with it, with digestion. That's something we want to talk about with them in regards to which turmeric product is being recommended. So other really fantastic extracts, which are often herbal in nature, are going to be that we use quite a bit in our clinic, are things like Boswellia, Devil's Claw, different herb, and bromelain, which is from that pineapple, which I mentioned before. And then we also will use glucosamine and chondroitin for some patients, and MSM. And you'll see in these 3 different products, just for examples for you guys, like this is our bromelain that we'll use, and it's just a straight bromelain. And that can be really nice to use those proteolytic enzymes alone for people who are really highly sensitive to certain other herbal reactions, that kind of thing. So sometimes we'll be using that, and we'll show you the data on bromelain in a second. This Cell Rescue by Mountain Peaks is one that we've used for years and years. It's a nice combination of several of these anti-inflammatories. So you see the bromelain here, you see another protease here, you see the serenzymes, which are another ceratopeptase that helps as an enzyme break down the inflammatory immune markers, which is nice, or compounds, chemicals. We also see quercetin here, which is a well-known antioxidant and anti-inflammatory. Here's our turmeric showing up in this formulation. Ginger showing up in this formulation. We see a lot of research on ginger that's helpful for joints and osteoarthritis, as well as Boswellia, another one of our favorite herbs, which is frankincense, to show up as an anti-inflammatory. This next product, ArthroSupreme or ArthroSoothe Supreme, is going to have that glucosamine and the MSM. There's a lot of research about glucosamine. We're going to show you guys a meta-analysis in a second here. And then there is that Univestin, which we talked about before with that Chinese skull cap in it and the crutch tree. And remember, with these, this is an interesting one because it's like, well, why would we want a proprietary blend? Sometimes we want to just extract certain components from herbs and not others because of potential side effects from the others. And then there's a beauty sometimes in having these products standardized, in that Univestin in particular, when I was doing more research about it, it came up that it screens for all of these contamination products, which is really nice. So they do these big batches. So they're guaranteeing when they have these products that are proprietary that they've been screened to make sure that there wasn't an incorrect herb harvested, for example. That's actually really common, I guess, with the Kutch tree, that there's an incorrect herb that gets batched in there. So just interesting that they do that. And one of the reasons why sometimes we're asking people to take these capsules or these supplements rather than having them like brew the whole herb or something like that, even though we do love our herbs. So these are just some examples that we'll use. You also might see green-lipped mussel. That's another one that has some interesting evidence in it for osteoarthritic pain and reducing inflammation. So here's our research on bromelain, and this was a review on bromelain that came out just this year, actually, which is pretty interesting, that's showing that this proteolytic enzyme can help as an anti-inflammatory, and it also has antioxidant effects. And it also seems to be affecting the neurologic system. So it kind of goes back to what we were talking about, that central nervous system being part of this issue when we're talking about osteoarthritis and degenerative joint changes. So it's kind of interesting. It can help with reducing that neural inflammatory response.
So another big herb here is the devil's claw, which is different from devil's club. So different herbs, different ways of using them. Devil's claw is when I think of my herbs for osteoarthritis, I think of the claw hand, and this one comes to mind. So this one actually has a lot of good folk data, but also more mainstream data on a extracted herbal product that has 60 milligrams of the anti-inflammatory constituent known as harpagoside. So this study looked at a devil's claw being similar to an autoimmune drug known as rofecoxib. Am I getting that right? Is that it's no, it's an NSAID. I apologize. So NSAID, as compared to the devil's claw, is being used for chronic low back pain. And strong evidence exists for the use of this herb as equivalent to the NSAID. So again, I think these studies are really enlightening because they give us a sense for, most people will come to us on some sort of NSAID therapy. They give us some evidence for, okay, how do we diminish those NSAIDs and add in some herbs that have a lesser side effect profile usually than the NSAIDs do. So here's just another example of that. So
Here's our, oh, sorry, go ahead. Oh, okay. So this is a meta-analysis that was done in 2021 about glucosamine and chondroitin. We have a lot of patients who are on glucosamine. This is something that's been touted for quite a while in the medical literature as being potentially helpful for joints and reducing joint degeneration. This specific meta-analysis was I was kind of surprised. It was a little bit ho-hum about how much improvement we see. It was like 50% reported improvement kind of overall when you look at all of these studies combined with long-term use of glucosamine. But what they did say that was really interesting is kind of written here at the bottom where they say preemptive administration. So that means giving a person who has not already degenerated with osteoarthritis. So doing it as a preventative measure at higher doses. So that's looking at probably 1,500 milligrams to 2 grams a day. Then we start to see an improvement with osteoarthritis and with outcomes, with clinical outcomes. So we want to kind of put this glucosamine and chondroitin into our preventative kind of medicine thought bubble. And it's something that can be coming in to some degree in our foods. If we're having things like shellfish and, eating more of kind of a ancestral style diet, we're getting some more of these building blocks for our joints.
So the last herb we definitely want to highlight here is the use of cannabis and specifically CBD products, cannabidiol, as extracted from the cannabis plant. So what's so interesting about this article is that CBD was used for a whole bunch of different groups of patients, those with osteoarthritis, those with rheumatoid arthritis, those on other medications, those without, and ultimately they saw an improvement in most every metric they looked at. So improvement in pain in 83% of people, in physical function in 66%. Additional benefit in sleep quality, right? When we talk about circadian rhythm dysfunction and osteoarthritis, this is a big one. And then what they also saw is that for the osteoarthritic group, they had a greater percent reduction in pain as compared to the rheumatoid arthritis group. So it's just so interesting how these herbs work, and sometimes better, sometimes worse for other conditions, sometimes better for one person as compared to the other. What again, a huge take home from this article is that the clinicians were able to reduce other anti-inflammatory medications in 31% of patients, specifically those NSAIDs, reduce Tylenol or acetaminophen in 18% of patients, and reduce opioids in 8.6%. So it's just, yeah, it's just really helpful to have both on board, and both playing together. It's just a blended treatment plan ultimately.
I mean, that's pretty impressive that, we're able to add something like a CBD, which has such a low risk profile, and help people to come off of some of these really high risk medications, or potentially damaging over long term. And that's really one of the biggest takeaways that I think Dr. Rosalie and I have seen with our patients with the use of CBDs, is that ability to help patients step off of some of the higher intensity pharmaceuticals for management of their pain, with their joint pain. So we wanted to share some of the common kind of topical, we call these analgesics. These are things that help reduce pain, that we use at Prosper. So these are kind of doing two pieces. One, they help reduce that immediate pain response and help with that feedback back to the central nervous system to reduce pain. But they also can be anti-inflammatory depending on which product we're using. So most of these have a menthol or camphor quality to them. So here's this is probably the oldest remedy that we have available, as far as like has been used with humans for the longest period of time, this on healing balm. And we have a liquid and a salve that's used, and this is a very old traditional Chinese medicine style compound that has, been around for a long time and is used pretty liberally on painful joints. It is quite mentholated, so it can, really sting if you get it on eyes or genitals. So we're usually warning people about that, but it can be really, really helpful too, just for improving mobility and things like that, and reducing that day-to-day pain that can be limiting folks. We also will sometimes use things like this ArthroSooth cream, which includes, and this is a Designs for Health product, and it includes several different antioxidants and anti-inflammatory herbal components, as well as that menthol. And you can see like there's eucalyptus in here, and we've got arnica in here, we've got oregano, calendula. It has a small amount of capsicum. There's really interesting research on capsicum, of course, for pain modulation topically. It also has a small amount of white willow bark in it, which is similar to the extract that's used to make aspirin, so as an anti-inflammatory. So we've got some really nice anti-inflammatories in here, and sometimes we'll be recommending that kind of topical for patients. We also will occasionally use the CBD topically, not just internally. And many of you have probably tried this now that it's become more available. And this is just only CBD. There's no THC in this specific product, but it is a mentholated, and it does have camphor in it as well, product that is very cooling and very soothing for the joints. And you're looking at about 400 milligram dosing for every application of this specific product. So it's a pretty high amount of CBD that's coming in, which can be really, really helpful.
So the naturopathic approach here, in summary, is to not think about this from as orthopedists, right? We're not just looking at the joint and what the joint's doing or not doing. But again, we're just zooming out, looking at the whole picture, not just physically, but also mind, body, spirit, right? What is inflaming you that could be contributing to your joint pain? There's so much involved in pain pathways and in degeneration of joints that is that that has to do with the entire body. And I think particularly when it comes to brain and neuroinflammation modulation, when I think about the gut-brain axis and the GI tract, how the microbiome is doing, and then specifically, of course, in the joint itself, what is happening in there and the joint CNS axis. And then lastly, is there extra adipose tissue that's actually inflaming the body further? So this is just a nice takeaway slide. Again, we're giving you this image to add to your brains and think about later as well.
We want to invite you guys to our next Doc Talk, which is going to be on March 14th. We're going to be talking about ketogenic diets. So it's a pretty hot topic and has been for several years. So we're going to kind of dive into that with you guys. So we want to welcome you to reach out to us if you need to make an appointment or set up a time to talk if you have specific concerns or want specific recommendations. You can get a hold of us by calling us or checking us out online. We've got a scheduling portion of our website as well. Remember that those other doc talks are on there too. If you heard something today that kind of made you think, oh, maybe this other piece is involved in my joint health, perhaps go through those doc talks, and maybe it's something about your microbiome. We have one on that. Maybe it's something about your circadian rhythm with your sleep or your stress management. So we've got several of those, and we hope that they're helpful tools for you guys kind of in untangling the web that might be involved with your health. So we'd love to take some time to just answer any questions